As treatments go out into the community, as clinicians we have less control, and there are great examples across the literature. We have examples from acute leukemia where children move into those tablet phases. They're taking as outpatients that actually you don't take the tablets, you tend to relapse on the back of maintenance when you're on maintenance. We've got the chronic myeloid leukemia story with imatinib. They did that really clever thing when they actually put those devices to assess how often patients were going into their medicines and found a clear correlation between actually taking your drug and staying in remission. And this is coming to CLL now because these new therapies depend on ongoing oral therapy, and the patients are going to have to be engaged. They're going to have to remember how they take them, when they take them, and they're probably going to have to maybe tolerate a degree of low-level side effect toxicity that is the type of thing you tolerate in a short, sharp burst of treatment. But actually when you have ongoing therapy, if you've got a low-level toxicity, bit of nausea, bit of diarrhea, bit of rash, that actually, as it grinds on over the months and years, may influence whether a patient actually does take that drug. It is also beholden on us, the broader CLL trial community, to come up with trials that can address this. Because most of us in this area of medicine feel that with combination therapies, we may well be able to achieve these aims. We know that some of the new drugs like ABT-199 are achieving MRD negative remissions. We know that the pathway of attack is different from a drug such as ABT-199, which is different from ibrutinib, which is different from antibody-targeted therapy such as GA101. And it's a natural development of therapeutic trials to think combinations that could push the depth of remission to allow patients to come off therapy. And that could lead to the goal of blocks of therapy and then off, and possibly a true depth of MRD negativity that could translate into cure. Wouldn't that be amazing?